Hello, I'm Dr. Wendy Young, and I'm Canada Research Chair in Healthy Aging at Memorial University in St. John's, Newfoundland. I'm delighted to be given this opportunity to create a video to share with you why we wrote this paper, what our findings mean, and what they actually mean to healthcare leaders. My co-investigators are Dr. George Klima, who is an e-health researcher at Memorial University, and Dr. Winston Isaac, who is Director of Health Information Management Program at Ryerson University in Toronto. All three of us are really very passionate about the potential of new technologies to improve patient outcomes, provider outcomes, and health system outcomes. George is currently leading a study looking at the implementation of EMRs in physician offices. I'm currently leading a study looking at how we can help older adults to continue to use the computer once they develop medical problems. And Winston's really very passionate about students using the best possible evidence to influence practice in the acute care institutions. So why are we interested in this particular study? Well, in order to realize the wonderful potential of new technologies, healthcare providers have to accept the new technology. And there is some literature on acceptance of new technologies. We know, for example, that physicians are likely to accept a new technology if they judge it to be useful. In addition, they're more likely to accept it if it's easy to use, provided that it is useful. There's still quite a lot that we don't know about the acceptance of new technologies. And it was really because Winston is the director of the Health Information Management Program at Ryerson that we had access to data on the implementation of an electronic data management system in an urban institution. So we had the opportunity to analyze data on acceptance, and after analyzing that data, we were really very excited about sharing the lessons that we learned through the analysis of that data with individuals who have the potential to actually increase acceptance in acute care institutions of those new technologies. So what are our findings, and why should healthcare leaders care about our findings? Well, you can read the results in the paper, but just to highlight a couple of findings. First of all, what we found was that people were much more likely to have a positive attitude about the new technology if they had attended an open house forum. And this suggested to us that healthcare leaders really start thinking about incorporating training sessions into regularly scheduled meetings where there is high attendance. We also found that acceptance differed by professions. So, for example, we found that nurses were less likely to accept new technology than were physicians or administrators. And this really suggests to us that training needs to be tailored to the profession. So what do these findings, as well as the other findings that we've highlighted in our paper, actually mean to the healthcare leaders? Well, first of all, acceptance is a very real issue. It's very important. Training costs our healthcare system a lot of money, and much of that money is not well spent. Leaders can start using research findings to increase acceptance. If we were to use these findings as well as other findings to increase acceptance, then we believe that it's much more likely that healthcare providers will accept new technologies and that will realize the potential of new technologies. And our bottom line, we believe that these findings, as well as others, can lead to improved patient outcomes, provider outcomes, and health system outcomes.